Today's segment will be on chiropractic for kids when it is indicated to have a spinal x-ray. At Maximize Chiropractic, we always focus on identifying the subluxation underneath x-rays. The x-ray on the left is a normal C-shaped curve in a child. When we look at the x-ray on the right, obviously this is not a normal C shape. It is going in the opposite direction. And what's important is if you look at the different angles, we've got these bones that attach and connect. This one's going off in an angle differently. And then as you see, it starts to go in the opposite direction. When we look at the effects first that can happen to this, most of you are thinking, how could something like this happen to a child so young? The first item is going to be trauma during the birth process. Typically in, this country, we like to ignore the natural process of birth. Instead of having a natural vaginal delivery, we like to perform cesareans, give medications like Pitocin. We like to then forcefully extract the children, ignoring that their heads are attached to their necks. When we look at then they start to gain the ability to walk and crawl, they then start to have a loss of this curve, and this is significant ligament damage. When we look at the effects of having a reverse curve in the neck, like we see on this young child, we first have to realize that most children do not opinionate concerns with pain. Sometimes children will say, hey mommy, my neck hurts, and generally the approach in our country is, here's a Tylenol, honey, go ahead and take a little break. However, when we look at the true cause of why children are brought into my office, it is generally organ specific, and more commonly out of others is for inner ear or ear infections, and those two are closely related, or digestive issues, and usually they come in with both of those. So when we look at this, how can the reverse curve cause or contribute to the infections of an ear? When we look at the bones that are affected the most, it's the top two bones in the neck, and that's why the angle is going in the opposite direction. These two bones specifically surround and protect the area closest to the brainstem. And the brainstem houses 12 nerves that control everything to the heart, to your digestive system, to sleep patterns, but they also control the specific nerves that allow the inner ear to function. So if a child has this, their nervous system is not going to be functioning as if their spine was normal. So it puts them at a higher predisposition to ear infections. And ear infections in our country are typically treated with antibiotics. And it is generally not resolved because most kids with ear infections have 1, 2, 3, and I usually see children when the number gets to about 5 or 6, which logically, if it didn't work once, I don't know why it would kept on being tried again and again, but that logic only works with medicine. So when we look at this, a parent brings in their child with reoccurring infections. They will always have tubes placed in the ear. In this child's case, it wasn't just once, but it was twice. And there is generally always an underlying infection that is happening. So when we look at this, there is pressure on the nerves that control the inner ear. However, that doesn't explain also the infections. So if we look at this x-ray, which is the same child in the lower spine, you will see that, first of all, the spine's not straight, which isn't the cause of this, but when you see the black on this x-ray, you can see all the backed up fecal matter, and you can also see just the overall obvious indication of a leaky gut. And your immune system, 80% of it resides within the gut. So if the nerves that control digestion through the autonomic nervous system, if those nerves are affected, it will affect the gut, which will affect the immune system, which will place a child at a higher likelihood of having reoccurring infections. When we look at ear infections, there's a lot of ways to treat the condition, but there are very few ways of getting to the underlying cause. In corrective chiropractic care, our focus is not to treat organ-based concerns. Our goal is to treat the subluxation pattern to correct the spine through corrective adjustments and corrective therapies, and to allow that nervous system to function and heal, which in turn allows the symptoms to subside. If you have a child who is having a reoccurring infection or is not reaching their full potential, and you've exhausted the attention of medicine, you've had reoccurring infections, reoccurring diagnosis, and the medicine is not curing the problem, look at something else. And chiropractic works in combination with your medical doctor. We do not treat conditions of the organ system. However, we do see resolution of symptoms very commonly, as chiropractic works on allowing the brain to heal the body. And that's why it is our assumption that the body is made to heal itself. It is a self-regulatory system that is designed to live in a focus of health versus designed to live in disease.